Non-Communicable Diseases and COVID-19, presented by Dr. Mohamud Verjee. Dr. Verjee qualified from the University of Dundee, Scotland, UK. He worked as a family physician in Oxford until 1994 before moving to Alberta, Canada. In 2003, he was appointed Clerkship Director for Family Medicine at University of Calgary, Alberta, Canada. In 2007, he joined Weill Cornell Medicine, Qatar to set up the Primary Care Clerkship. He is now the Assistant Dean for Medical Student Affairs and continues to work as a practicing physician. In our today's Challenge of Change program, Dr. Verjee will focus on non-communicable diseases and how people with NCDs are at higher risk for COVID-19. At the end of the session, Dr. Verjee will be happy to respond to as many questions as possible. You may type in your questions during or after presentation in the Q&A box below. Without further ado, let's welcome Dr. Verjee back to the Challenge of Change platform. Over to you, Dr. Verjee.
Good evening, everybody. I'm delighted to be with you, and hopefully we'll share a very informative session tonight on non-communicable diseases, known as NCDs for short. We are also associating that topic with COVID in our present era. I'd like to show you a brief PowerPoint, and actually define what a non-communicable disease is. This is an illness that cannot be passed from one person to another. This illness, this NCD, cannot be caught by anyone you meet ever. It's very important to understand that principle because in the present COVID climate, we are all worried about infection of this disease. When you think about health, you need to think about the wheel of health, not only today, but every day, in particularly today because of the COVID era. So you are the center of your health control, and you look on a daily basis to keep yourself well with prevention and intervention for anything that might affect you or make you ill. We have conventional approaches with neuropathic doctors who provide all the health care that you may need when you need it. But you also need to think, not constantly, but you need to think about your health periodically and be aware of the possibilities when you have NCDs. Now, non-communicable diseases are extremely important because they kill so many people each year. It's estimated that over 38 million people die from NCDs each year, and that probably about 80% of all deaths, something like 29 million, are in low or middle income countries. But remarkably, more than 9 million of all deaths from NCDs occur before the age of 60. And it seems sad, but it's true that more than half of those are women. One of the NCDs which we focus on today is a calculation of body mass index. People often see this term, BMI, and say, what does it mean? Well, it's a calculation of your weight divided by your height squared. So, for example, if you weigh 81 kilograms and you are 1.72 meters tall, you actually have to multiply your height, 1.72 times 1.72, which is approximately 3. 81, your weight, divided by 3 is 27. Now, the recommended BMI for Western industrialized nations is between 20 and 25, regarded as the healthiest bracket to be in. Once you actually start to go over 25, you are regarded by a physician or by a nutritionist as overweight. That is when the term overweight starts. When you actually get to a BMI of 30, that is when you may be referred to as being obese. We talk about obesity very commonly, but when you get to a BMI which is above 30, that is when the real dangers can start. Unfortunately, we are not all from the Western industrialized nations, and most of us ethnically are from South Asia. Most of the community is certainly of the same genetic origin, and the figures have been adjusted for South Asian people such that when you get to a BMI of 28.5, then in fact you are regarded as obese. So it starts earlier for South Asians. An important thing to bear in mind is your waist and hip ratio. People's hips are always larger than their waist when they are healthy. When you get to a stage when your waist is bigger than your hip size, then that's an indication of a problem. You're talking about males, dividing your waist into your hips, you must have a ratio of less than 0.9. When you're talking about women, females, you need to have a ratio of less than 0.8. So if, for instance, your hips are 40 inches and your waist is 30 inches, that is going to be 0.75, which means that you're very, very healthy. So don't worry about having large hips. It's actually to your benefit, especially for women. I'm going to ask you all, what are the increased chances of developing diabetes, one of the world's best known NCDs, if you are an overweight man and an overweight woman? So assuming that a normal person has a chance, or has a figure of 1, how many times higher would a man be likely to develop diabetes if he is overweight? That remind you that that is a figure of a BMI over 25. Is it 5 times, 20, 40, 50, or 100 times? And what is the same raised rate for a woman? Again, is it 5, 20, 40, 50, or 100? I'm going to have a poll at the end, so remember and think about those figures. Decide which one for a man and which one for a woman. I'll give you a hint here, they are different. Many people say, how do you reduce your health risk in the COVID-19 era? So you need to look at your environment, your lifestyle, what you do, your sleep, generally the way you actually live. If you actually are well and you go to your doctor periodically for tests, for blood pressure, for blood tests, for glucose, for cholesterol, that is routine. And if you have no problem, you just carry on and continue your way of life. However, if you know that you're gaining weight, that you have reduced sleep, that you have lack of energy, that you feel tired, and symptoms like that, you do need to get a check, and the various checks will be done. And if in fact you happen to have high blood pressure, or you have diabetes, or you have high cholesterol, or you may have something wrong with your heart, then you can take action straight away, and your doctor will help you to return you to the most satisfactory and stable state of health that he or she can. Exercise is known as a medicine these days. It's very important to keep mobile and to undertake some exercise regularly for at least 30 minutes, I beg your pardon, 30 minutes every 5 out of 7 days, preferably all 7 days of the week to develop a habit. 30 minutes. That's all you really need to do to have the commitment, the minimum commitment to exercise. And that means getting slightly out of breath and exerting yourself and also climbing steps. 7,500 is the minimum recommended. 10,000 is fine. Set a figure for 10,000, set a target, and if you don't make 10,000 and you've made 7,500 steps, that'll be good enough. And it's very important in this day of plenty. We are very fortunate. We have everything available to us in the Gulf countries. We should not overeat. And we should pay attention always to a healthy, nutritious diet. So my brief discussion, I want to cover a few other things, and just to recap. NCDs, you may well say, is it just diabetes and heart disease? No, it's much more than that. It covers autoimmune disease as well. And one of those you may have heard in these times of COVID is lupus. There's another one called hepatitis and other things which perhaps didn't really seem to be regarded as NCDs, but are, like strokes or severe heart disease, heart attack, cancer, kidney disease, arthritis of your bones, osteoporosis, and even Alzheimer's disease. Now, I just want to remind you that most of these NCDs are renamed because of their importance. There may be some overlap with chronic disease, but chronic disease is an older term now, going out of fashion. NCDs have been targeted because they are, as I said, a cause of considerable morbidity and death. I remind you, in 2012, NCDs caused 68% of deaths that were from NCDs, that's 38 million, compared to only 60% in 2000, still a very big figure. Risk factors are a person's background, lifestyle, and environment. If you don't look after those, your chances of developing NCDs are higher. For instance, 7.5 million people die because of untreated or unstable high blood pressure. At least 5 million die from tobacco use. 2.8 million people die from just simply being overweight and the complications it causes. And about 2.6 million people die because of raised cholesterol. So what are you likely to change as a result of your learnings today? I now invite questions. Just before you ask questions, I want to raise some other points. And the points are that in recent weeks, we've had a very important message circulated, which said that we must, by Maulana Hasramam, which said that we must exert the utmost rigor in looking after ourselves and to safeguard our own health. Utmost means the highest rate, the highest grade, the extreme of best, if you like, the greatest. And rigor means really being extremely thorough and careful with your own health, looking after yourself. It is important to know that these factors will certainly help you in this COVID era and hopefully protect you against any kind of infection problems if you actually do get COVID. I'd like to ask a few questions now, and I'm handing back to you, Dilshad.
Thank you very much, Dr. Verjee, for that insightful talk. We now have few questions from our participants, and we can begin with our first question. Recently, with the rise in number of COVID-19 cases, there is also an element of stigma. It is seen as a shame, and some may feel that they should hide news related to their loved ones being diagnosed with COVID-19. So my first question is, how other people should respond if they come across someone they know who has COVID-19? And secondly, how should the person with COVID-19 himself or herself feel towards themselves?
I want to say that anyone developing COVID-19 as a disease, either mild or more serious, should never be guilty. It is not a cause for shame. It is not a problem in the sense that it should not be regarded as a stigma. If you were to meet anybody with COVID-19 infection, the best thing is to show empathy, to say, I'm sorry you feel, sorry that you have this disease, I do hope you get better, and to support them, to give them the encouragement and hope that they will come out of it unscathed and return to normality. About 80% of all those people who develop COVID-19 recover fully without serious effects. If it gets more serious, of course, there are the problems of access. Families can't often see their loved ones when they're in hospital in intensive care. So it's not really a question of stigma. It's a question of confidence and ability to overcome that particular problem. Anybody who has COVID-19 should look on the positive side and say, I am getting hopefully the best health that my health authority can provide for me, and to keep in touch. Of course, we know that there have been a lot of casualties and a lot of deaths. In the US alone, they have reached over 100,000. But if you maintain social and physical distancing, a rigorous standard of hygiene, and observe government guidelines about when you're out wearing a mask, making sure that you actually don't have social gatherings and parties which are a risk to developing or catching the infection, you need to be responsible. All the governments provide guidance. The people themselves have to share that responsibility and be responsible, and they need to work together. If we are to come out of this as quickly as we can, those guidelines must be followed. So if you have COVID, of course there's sympathy, and of course there's empathy. But please remember that most people will recover, and you should feel no sense of stigma at any time.
Thank you very much, Dr. Verjee. Our next question is there a risk of any of these diseases if you have recovered from cancer and are currently a bit overweight?
Well, I've already mentioned that diabetes is a problem, but the issue here, and I'm going to come back to the poll, is that if you are overweight, you have a much greater chance of developing diabetes. So these go hand in hand. Not only are there problems in your body in a metabolic way, in a chemical way, but also in a physical way. So diabetes expresses its damage in many ways. It can affect your eyes. It can cause blindness because there can be bleeding. It can affect your heart and cause heart attacks. It can affect your kidneys and you get kidney disease. And it can also affect the health of your nerves. The nerves in your legs are most commonly affected. And that's called a neuropathy, where the nerves get damaged and you can't feel the sensation as you normally do. So this is not just one separate particular variety. This is a continuum. And in addition to that, if you have two NCDs, like high blood pressure and diabetes, and then you add a third one with pulmonary disease or lung disease, and then you add a fourth one with kidney disease, they are all interrelated. So it's important to understand your health and to address the problems as they arise so that you limit your chances of progression for poor health, taking into account everything I've mentioned before, like exercise, healthy nutrition, environment, and so on. What are the increased chances of developing diabetes if you are an overweight man? For men, it was 20 times higher. They are correct. 20 times higher chance of developing diabetes if you are overweight, with all the complications and all the health problems that ensue. Now, for all women, I hope you're all sitting down comfortably, because the figure is not the same. Unfortunately, it is much higher, much, much higher, and it has been rising over the past 15 to 20 years. It is now 100 times higher. You have a 100 times higher chance of developing diabetes if you are overweight and a woman. This is extremely important to understand, and you can do a lot about it. We've mentioned healthy nutrition, we've mentioned exercise, and I also alluded to sleep. So I hope that figure didn't shock you, but in the past 20 years, they've been consistently rising, and you must take notice.
Thank you very much, Dr. Verjee. I think this is a very shocking figure for all of us. Thank you very much once again. My next question is from audience. What should be the frequency of comprehensive health checkups for individuals above 50 and have either one NCD, could be diabetes, blood pressure, obesity, etc.?
Well, this is a question that has a variable answer. I would say that all healthy people, regardless, certainly over 50, should have a check once a year, at least. If you have blood pressure or diabetes or pulmonary disease or kidney disease, you may need a more frequent check. So that could vary between 3 months or 6 months or a year. If you're stable and you have diabetes and you have hypertension, for instance, you actually probably don't need to be seen thoroughly, if you like, comprehensively, more than once every 6 months. But some people with diabetes or hypertension, which are not well controlled, need to be seen sooner, more frequent intervals. Not only do they need to perhaps be seen at 3 months, but they may need to be seen every 2 weeks until they achieve stability. So it's not really a rule, it's according to need. And blood tests for diabetics are usually taken not necessarily with the doctor, but a routine lab every 3 months. Certainly that's advisable.
Thank you very much, Dr. Verjee. Our next question is, as we come out of lockdown, what do you suggest to those who have NCDs? It can be any obesity or high blood pressure, to do when they go back to work or go to shopping, etc.
I think it's very important. We will emerge from this restriction that we find ourselves in right now. Although we're very lucky because we actually can leave home when we need to, but the advice is still to stay home as much as possible and go out as little as possible. When the restrictions are lifted and people go back to work, I want to reiterate that it's very important to follow the guidance of every Gulf country's regulations and guidance. Now there is an app to be used where the government can trace everybody. In certain countries, it has been made mandatory to be tracked. And you should not fear this. This is for your own good. So they could identify people who you may have been in touch with and preempt any development of disease in yourself. It's very, very important, in fact, to maintain scrupulous hygiene, to not have a distance less than at least 2 meters. 1.5 meters is recommended, but as far as you can without being antisocial. You should also wash your hands regularly and you should wash your hands whenever you touch anything which might be a place where you can pick up COVID-19 virus. That includes door handles, plastic, anything that is really not in your household, which you know is clean, but anything outside. I hope that answers your question.
Thank you very much, Dr. Verjee. Our next question is, what is the effect of herbal medicine to normalize diabetes?
Herbal medicine has its place, and it's very well known in India. Ayurvedic medicine has a famous reputation. It goes back 5,000 years. But today, the conventional way to treat diabetes is not just medicine. It is looking after yourself, as I've said before. But we know that many people will need insulin injections, whether they have type 1, which they need it mandatorily to live, or type 2, where their diabetes is not well controlled. The addition of healthy nutrition, like vegetables and fruit, in particular high concentrations of fresh fruit rather than and fresh fruit and vegetables rather than vegetables which are being boiled, so a lot of the goodness is lost. On a regular basis, nutrition has been one of the most important factors that we have overlooked over the past decades. Unfortunately, we're now in an age where we live with a lot of processed foods. Now, talking about homeopathy and alternative medicine, that may, in fact, be an option to consider with regard to nutrition, but it may not. It's not a cure, and it requires a very great deal of discipline to stick to homeopathic remedies. Some, we know, have been touted as being good, but in fact prove to be falsely good. So you must be very discriminate to whom you go to and get the advice and treatment from. So I'm not throwing it out as something which you shouldn't use, but it's not the panacea of treatment. You need to go for conventional treatment to make sure, because it's evidence-based.
Thank you very much, Dr. Verjee. Our next question is, what are the reasons behind women having a significantly higher chance of developing diabetes if they are overweight?
Well, I think I've hopefully explained. Once you actually become overweight, you have an inflammatory response. That, in fact, is what COVID-19 attaches it to. When you have an NCD, your body is already inflamed. COVID-19 amplifies that. It makes it even worse. So if you can imagine having a high degree of inflammation in your body from something like hypertension or diabetes, you can expect things to become abnormal in yourself. You actually produce a different balance of chemicals in your body. You affect certain organs in your body. And after a while, the healing process turns on itself. So in trying to heal your body with, say, diabetes and being overweight, you actually the body unwittingly ends up harming itself because of the drive to heal. It actually overheals, and when it overheals, it causes more inflammation, and that inflammation is damaging. Some people may not have damage to their eyes, or they may have damage to their eyes only. But statistically, you have to look out for your organ health, and being overweight in a prolonged way and not addressing it is harmful.
Thank you very much. Our next question is, can you help us understand why people with NCDs are at higher risk of COVID-19?
Well, I think I give you a part explanation in the last question. Because of the inflammatory process of the NCD you already have, and as I said, you may have more than one or two, that inflammation in your body is an opportunity for COVID-19 to get a grasp. So it's rather like perhaps having your house warmed up, and you open your doors and you let the heat go out. You provide an entry for COVID to say, here is my chance to infect this person, I'm going to take it. If you actually are careful and you don't allow the opportunity for COVID to harm you, you should be, to a certain extent, protected because the inflammatory response you have is very low. If you have a low response, then the COVID has a much more difficult chance of infecting you, particularly associated with hand hygiene, washing hands, social distancing, and so on.
Thank you very much. Our next question is, despite following healthy lifestyle, we hear that people get NCDs. I understand there are other genetic factors that could cause NCDs. How can normal people know what the other tests their doctors are conducting during annual checkups, and if they are thorough enough to cover the potential NCDs?
That's an excellent question. One of the warning things about NCDs is that very often doctors ask, is there any particular NCD in your family? They'll probably ask you on diabetes or heart disease or kidney disease or raised blood pressure. And you may have no to all of them. In that case, you are at very low risk. But yes, there is a genetic component, although it's not automatic, it's not guaranteed. So if you have parents who have diabetes, you may not necessarily get it ever or at all. However, if you have someone in the family who's had an NCD, it is a warning sign for you to take note, to say, well, looking back on them, they were both overweight, they had heart attacks, they had lung disease, someone smoked, and so on. And those are part of lifestyle things which we need to take care of. There should be nobody smoking at all. If you don't smoke, you will not have the pulmonary diseases and the cancers that can be associated with it, let alone chronic chest problems, pneumonias, infections, and debility. So there is a genetic component. There's also environmental components. So you are more liable to an NCD, and that includes some types of cancers, especially skin cancer, if you don't take any protection, if you sunbathe without protection, if you're in the open, broad sunlight, working outside and not using any protection to cover your head or protect your eyes or your hands. So it is a complex question, an excellent question, but there are many factors and not one simple answer. Doctors should guide you and let you know, and I would say anybody undergoing any test should have a full explanation of what that test is for, why it's being done, and that the result will be communicated, not only if it's abnormal, but if it's normal. I think anyone who has been poked for a blood sample should know the result, and it doesn't take very long to find out, and you can get copies of that result for a personal file that you may want to keep to record what you've done and what you've had done to you.
Thank you very much, Dr. Verjee. Our next question is there any relationship between NCD with South Asian people? If yes, can you please help us understand that relationship?
Unfortunately, South Asian people seem to suffer more from some of the NCDs, like heart disease, like blood pressure, strokes, diabetes, at a younger age than Caucasian populations. It is, in fact, one of those things we have to accept in our order of life. What cards are handed out to us. As long as we recognize the fact that there is a genetic risk of developing some of these problems, then we need to monitor our progress of health throughout our lives and address the problems as they come up. It does not mean you have to run down to the doctor every 2 weeks or every month or see 3 or 4 doctors to get a different opinion. No, that is not necessary. You need to understand what's going on, stick to the carer who takes the most interest in you and explains everything to you and welcomes you whenever you need to go, whether it be 2 weeks or 6 months, with the same approach. Develop that professional relationship, share your thoughts and feelings, and you should have all the explanations you need on your health.
Thank you very much, Dr. Verjee. Our next question is, I have heard that sleep plays a major role in our health. Personally, I haven't seen people being very conscious about the quantity or quality of sleep. Can you share your thoughts on the relationship of sleep and NCDs?
Certainly. We know now from evidence that the best period of sleep duration is between 7 and 9 hours, regardless of who you are or what work you do. So if you get less than 7 hours sleep per night, you will actually have a shortfall. You will not be able to restore your body as well as you can do. If you sleep more than 9 hours, that can have a contrary effect, so that other factors come into play. For instance, if you stay in bed for 12 hours, having a long rest over a weekend, that excess from 9 to 12 is actually doing you a slight bit of damage every time. Your muscles get weaker because they're not moving. You actually may lose some muscle bulk. You may not be quite so energetic. You may be more fatigued. And you actually might feel, I don't really want to go out today, and eat a bit more. That's the beginning of the weight problems. Below 7 hours, there is another important factor. So if you only sleep for something like 5 hours, when you normally should sleep for 7, this affects your body's processes of healing. You will lose about 50%, about half of your nightly ability in immune response if you lose 2 hours of sleep. Imagine what that could do. So losing 50% of your immunity and then being exposed to the possibility of COVID-19, the chances are much higher that you might not be able to fight that off and that you might be in a worse condition than you might have been if you had restored your body and all the processes that go with it. There are 2 forms of sleep. There's deep sleep and there's what's called rapid eye movement sleep, or REM sleep. You usually go into deep sleep fairly quickly after you go to bed. It shouldn't take you more than about 10 minutes to fall asleep. Some people have the luck to fall asleep very quickly. Some people toss and turn for 20 minutes. Once you have your deep sleep and your REM sleep, effectively your brain processes is flushed and reset, rather like recharging your phone. You know it's low, you know it's on red, and you have to recharge it. Your brain needs that time to recover, and that brain controls your body. So sleep has been very much underrated and is extremely important. One more fact I want to mention, and that is that if you don't get sufficient sleep, your inherent steroid level tends to rise, and that in itself is fattening. So you actually, if you sleep for a very short time, even though you're pretty fit and you like to run around and do things, you will in fact paradoxically end up gaining weight because of the steroid effect. So you may say, I'm doing everything I can, but I'm still not losing any weight. And that's probably because you are short on your sleep period. And that's important to remember.
Okay, thank you very much, Dr. Verjee. Our next question is, if there are 2 things we can modify in our current life, what would they be?
I think without doubt, I have to go back to healthy eating and nutrition. I think that is of paramount importance. My secret to everybody is not a secret really, but I actually try and make it a bit more dramatic as a secret. And the answer to that is, when you eat and you're at the table, leave the table feeling you could eat some more. Don't give in to that temptation of having that extra portion or finishing off the bowl or what have you, and then saying as you get up, oh, that was a lovely meal. I can't do a thing. Let me sit on the couch and watch TV. That is the beginning of the downward spiral. So if you can remember that, then that's important. You also need to eat the right foods in the right order. So sometimes at hotels, you may find rolls and butter on the table, and the main meal is a long time coming, and you may have the first course and the salad course, and it hasn't come yet, so have another roll and what have you. And this is all to fill you up. And then when it comes to the main meal, of course, you're pretty full already, but your brain hasn't registered that. So important to think about healthy nutrition, the foods that you like, and there's plenty of variety. You can be very imaginative. The second thing certainly is to keep active. We know that activity, especially in later years, helps keep the brain functioning. Keep yourself fit, care for your body, clean it, look after it, and make sure that it gets all the attention it needs. And that includes exercising all your muscles, all your body, and making sure that you don't forget a single part down to your little toe. It's very important there to have the good exercise and maintain your body. The third thing I actually think is important is to try and minimize the stress in your life where you can. Everybody has stress, and some stress is good to complete a task, but excessive stress is not good. And you want to try and avoid situations where excessive stress disturbs your own natural pattern of life, such that you're unable to move forward or complete various tasks which you know you have to do. And that causes more stress because you're under even more pressure. So it's very important. Lastly, I have to mention, it's very important not to smoke, because that is absolutely the number one thing that we all as people can help ourselves by not developing this habit. And that includes shisha. I'm going to give you another fact on shisha, which is traditional and has gone on for a very, very long time. But now it's time to recognize that shisha is not recreational. Shisha is harmful. If you smoke shisha for 2 hours or more, it could be the equivalent of smoking 60 to 100 cigarettes in one go. Tell me, please, who would ever smoke 60 cigarettes in 2 hours, let alone a day, let alone a week? And of course, it's not clean. It may go through the bubbly water, but it's not clean, and it still has chemicals, whether it's scented with rose or any other thing. And that will damage your lungs, your heart, your eyes, and even some female cancers are made worse by tobacco consumption. So I think those are 4 things I want to emphasize.
Thank you very much, Dr. Verjee. Another question we have from our participants is, keeping empty stomach is good for diabetic patients. We just want to understand a little bit more from your perspective.
It's very important, actually, if you're diabetic, to provide the right carbohydrates, fats, and proteins at the right time. Those who have insulin injections will know the rigor of looking after yourself pretty well. You have to have an insulin injection about 15 or 20 minutes before having a meal. The meal is to replace your energy stores and to process the carbohydrate in your diet, in your intake. You absolutely have to have that. Having an empty stomach while being a diabetic is quite inadvisable. People can fast during Ramadan if they're diabetic, but they have to be very careful about being ill or actually missing out on the needs their body needs.
Thank you very much, Dr. Verjee. Our next question is, can you share your wisdom on challenges which people with NCDs are facing and or potential to face during this phase of pandemic COVID-19? If you can help us understand about ARBs and NSAID and whatever management they may be taking for their NCDs and how what they should be aware of.
Yeah, NCDs are going to be present whether there's COVID or not. Now, there has been some discussion about the dangers of certain therapies with blood pressure, including ACE inhibitors and ARBs. And I actually want to say that there are hundreds of myths and misconceptions going on right now. Sometimes things seem to be have an impact, and sometimes they are later on proven as not being correct. This is a totally new virus to us, and we don't have that experience. So we don't absolutely know from the outset what and what is not going to happen. A lot of it is by assumption. I want to say emphatically to anybody who has raised blood pressure, who has ACE inhibitor therapy or ARBs, and if you're on that, you'll know what I mean. These are certain drugs which are shown to be excellent in diabetes and in hypertension and blood pressure. You have no fear. The evidence is out, and it's been confirmed that you can continue to take your ACE inhibitors and your ARBs without any hesitation and without any kind of worry. They will not harm you. In fact, it will harm you if you stop taking them because you're hesitant and you hear these rumors and your blood pressure goes out of control or your diabetes tends to go out of control. So that's important for you to understand. I hope that is reassuring. I assure you the evidence is out and you should not worry. As far as NSAIDs are concerned, similarly, there have been multiple reports now, and not just from drug companies, to show that there is no problem whatsoever in taking NSAIDs or aspirin if you need it for pain or inflammation. That has been proven, and I want you not to worry for a moment at this time about that. Sure, there'll be one or two people who don't like and don't want to take and have some reaction with drugs. That happens with almost any drug that you are prescribed. But don't worry, carry on, don't stop your therapy, keep in touch with your doctor and get advice from your doctor. If you're worried, he or she will give you the same advice and monitor what you're taking. Maybe there's an adjustment of dose needed and so on, but don't stop your therapy.
Thank you very much, Dr. Verjee. Our next question is, can severe reflux issue also cause dry cough, and how different is this dry cough compared to the dry cough one has as a symptom of COVID?
The dry cough of COVID is actually quite special because there is nothing coming up. When you have an infection of your chest, you usually have something which you produce and spit out. The COVID reaction cough is a reaction to the body trying to heal itself. And there isn't any production in the lungs. Unfortunately, if COVID-19 progresses, it can actually end up destroying part of the lung. But that's not the whole story. COVID can affect any part of your body at all. It can be as serious as destroying your lungs and affecting your heart and making your blood thicker, if you like, more sticky, so you're more likely to have clots, and then that could actually lead to a heart attack. Some people have had mild COVID infection, and then within a couple of days with COVID, they've suddenly gone downhill very, very quickly and have died. And that's usually due to the blood being affected by the COVID disease. The cough you talk about, and as far as COVID is concerned, is unique. The cough that you get from medicines is quite different, because that's due to a release of a chemical already in your body, which is not normally released in an excessive amount, and that causes an irritation. After taking your medicines for a short period of time, that the body gets used to it, it gets tolerant, and it no longer reacts to that mild cough, which is quite different to the COVID-19 cough.
Thank you very much, Dr. Verjee. Our last question for today's session is, I worry a lot. I worry about money, about future, and about my health. Can worrying too much increase my risk of developing NCDs?
Yes, I'm going to answer this question in a moment. I just want to go back to the last question about reflux. And reflux can be with acid coming out from the stomach, can actually get stuck in the back of your throat, particularly when you go to sleep at night. And that irritates the tract, and you can have a cough like that. The best way to solve that is to have more pillows or raise the head of your bed. As far as the mental stress condition is concerned, that is very important. We have no doubt seen a rise in people who experience mental stress. This is natural. It's actually in reaction to the situation we find them in. I don't think anybody on this earth has had to regard a period of living like the past 10, 12 weeks that we have, where we are not imprisoned. We are free to move around, but we've been told to stay at home. Of course, we're going to dwell on many matters. Certainly the loss of physical contact with loved ones, with family, with friends, with colleagues, and perhaps also with places of community action, like prayer. That actually is something which upsets a lot of people. We have to be brave. We have to be secure in our mind that we are not ultimately going to have to live this forever. We are going to come out of it. We are all in this together. We are all guided by our governments. We must consider those guidelines and stick to them. As said before, we are partially, if not 50% responsible for making sure we come out of this, and then we can regain normal activity in life, in social life, in family life, in work life, in community life, and in business life. But we have to accept that there are changes, and we need to use our new skills that we've acquired in isolation to good use and not feel that it's all been wasted. Certainly there will be stresses. Certainly the physicians who see you are aware of this, and I hope they'll be empathetic and caring and recognize and give you the confidence you need to go on having a belief that things will get better. And they always do. Never think of the worst.
Thank you very much. Once again, thank you, Dr. Verjee, for sharing your knowledge and experience with us today. Your advice on how we can reduce our health risk and prevent NCDs is more important in the COVID-19 era than ever before. Thank you once again.
Thank you very much, and good night to you all.